couple of minutes.
All right, we are recording and there are some people still trickling in. So whenever you would like to get started, we are good to go.
Okay. Thank you, Vincent. Good evening, everyone. I'd like to thank you for being here today at our event, Pharmacists Caring for the Latinx Community, Past, Present, and Future. I will be one of your moderators. My name is Myra Boytel, and I am one of the board members. Today with me is also my colleague, Debbie Perales, who will also help moderate the event. So before we get started, just want to go through a couple of housekeeping items. So first of all, please keep your microphones muted so that everyone can hear clearly. Two, any questions that you have throughout the event, please make sure that you type them in the chat box. We will be monitoring. And then we will also, at the end of the presentation, have a 10 to 15 minute audience Q&A. Okay. So a little bit about NHPA. So our mission is to empower Hispanic pharmacists and other members to improve the health of the Hispanic population in collaboration with public and private sector partners. And our vision really is to be the lead pharmacy organization for improving the health of Hispanic populations in the United States. We comprise of 8 board members. Maria Hearns Rivas is our president. Unfortunately, she had a previous engagement and could not be here today. And we do want to thank our corporate board members, CVS Health and HHF, Pharma, and Walmart. Thank you very much for your support. Something that I wanted to share with all of you tonight. So if you're interested in possibly being a spokesperson for a Stop Vaping campaign that is sponsored by NHHF, you can be a spokesperson and it'll be a recording. And this is really a campaign for high schoolers and middle schoolers to really help them understand the harms of vaping. Something else we're looking for is if you're interested in being a mentor. This is a great opportunity to do a one-on-one mentorship. And if you're interested, you can see the link below where you can reach us. Our student chapters, we thank them and we welcome them. And hopefully we have some today as part of our audience. And this is how you can connect with us on social media. Please do. We love to hear from you. And without further ado, I'd like to present to all of you our speakers and panelists for today's event. So first of all, we have Dr. Rivera, who comes to us from the School of Pharmacy, Medical Sciences campus at University of Puerto Rico. We have Dr. Rodriguez, also from the School of Pharmacy, Medical Sciences campus, University of Puerto Rico. We have Dr. Ubaki, Pharmacy Manager at Walmart. We have Dr. Widner, Clinical Pharmacist and 340B Program Manager at Primary One Health. And we have Dr. Gil Flores. She's a District Leader at CVS Health. So for today's event, we will have a series of 7 questions. We're going to ask our panelists if they can maintain the questions to about 2 to 3 minutes, and that's really for the sake of time. Some questions will be referred to for all the panelists, and some will be certain panelists. And again, we encourage that you enter any questions that you have in the chat box. We will be monitoring, and we want to answer as many questions as we can. So let's get started. So question number 1 is going to be for all of our panelists. Question 1 is, what was your path to pharmacy and what is your current role? And we will start this question with Dr. Rivera. Dr. Rivera, can you answer?
Hi, everyone. First of all, I have 3 passions. I like chemistry a lot when I was in high school. Also, I enjoy serving others through community or faith-based organizations. And I love teaching. So pharmacy was the perfect profession in order to unite all of those and integrate it to my career path. In pharmacy school, I had a very wonderful experience caring for geriatric patients. And that, it was like a epiphany for me. So I decided to complete a PharmD degree and move to the US mainland, and then completed a PGY1 residency in geriatric pharmacy. Currently, I'm a professor at the University of Puerto Rico School of Pharmacy, and I am training to be the PGY1 residency pharmacy director at the VA Healthcare Caribbean in San Juan.
Dr. Rodriguez?
Hi, everyone. Good evening. Well, actually, I started as a chemist, so pharmacy is my second career. But while I was doing my master's in chemistry, I realized that I didn't really love working in the lab. I really needed to have contact with other people, and I wanted a profession that had that was more fulfilling for me, where I could make a greater impact more directly on people's lives. So I returned to school and I completed my PharmD. And as a pharmacist, I have worked for a chain pharmacy. I did so until very recently part-time. And I have also been a professor at the University of Puerto Rico School of Pharmacy for 2 years, where I precept students at my practice site, the University District Hospital in San Juan, Puerto Rico, where I'm also the antimicrobial stewardship pharmacist. So I'm involved in all aspects of the stewardship program, from day-to-day clinical activities to facility-wide decision-making. And I'm also involved in research and didactic teaching.
Thank you. Dr. Ubaki?
Hi, good evening, everyone. Thank you for having me. My name is Aníbal. So growing up, my parents always and I discussed the medical field, how big of an impact you can make. And fast forward, I went to University of Florida, had a great mentor that introduced me to the profession of pharmacy and explained to me all the different career paths. So if you take a look at our panel, it's very diverse, right? So, I love that about pharmacy. I then graduated from University of Florida and took a pharmacy technician job at Walmart. And that's where I first started about 10 years ago. I went to Howard University, graduated from the College of Pharmacy there. I was able to experience hands-on, face-to-face, how much of an impact we can make at the retail setting. I became a staff pharmacist for Walmart, and I love it. Currently the pharmacy manager in Dania Beach for a Walmart neighborhood market. We opened the store 4 years ago, growing as a business, growing in our community and making a huge impact, and I love it. And thank you for having me.
Thank you very much. And Dr. Whitner?
Hi, everyone. Thank you for having me. I originally came to pharmacy knowing that I love the wide range of patient care career opportunities throughout the degree when you have a PharmD and what you can do with it. And throughout pharmacy school, I really had a passion for caring for underserved populations and began volunteering in different free clinics and also mobile migrant health clinics. And once I finished pharmacy school, I proceeded to pursue 2 different residency programs, so a general pharmacy practice and then a specialized in ambulatory care with Ohio State University. And then it was partnered with a federally qualified health center. So the day that I stepped into an FQHC or community health center was the day I knew it was a place for me. It was a mission-driven organization. We serve everyone and anyone, regardless of insurance status, documentation status, or ability to pay. And so right now I feel very fortunate I work 2 days in a clinic seeing patients one-on-one, managing chronic disease states through collaborative practice agreements. And then 3 days a week, I do administrative tasks with our 340B program. And so I've also remained pretty heavily involved in the health of migrant and agricultural workers. I serve currently on the board of directors for the National Center for Farm Worker Health, and I also volunteer in our local clinical Latino free clinic in Columbus, Ohio.
Thank you very much. And finally, Dr. Gil Flores.
Well, thank you for having me, first of all. Thank you very much for the invitation. I am a 4th generation pharmacist. My mom's a pharmacist. My grandfather, my great-grandfather were pharmacists. My husband's a pharmacist. My sister's a pharmacist. And my daughter's in her second year of pharmacy school, actually. So we are a big family of pharmacists. And of course, it all began for me when I was in high school. I was one of those kids that I wasn't dropped off at home. I was dropped off at my mom's pharmacy. So I grew up living, my everyday life was in the pharmacy. And my mom was, of course, my inspiration. And I saw how the patients valued her, and, you know, they really seeked her for all kinds of health advice. And that's what inspired me to study pharmacy. So once I finished my career at UF, at University of Florida, I actually went to work for Eckerd Drugs. I was there for 15 years as a pharmacy manager. And then I decided to make a change, and I went to Navarro. So I went from a huge, giant corporation to like a very small mom and pop operation. And really, it was like quite a difference. Later on, we were acquired by CVS. So I tell everyone that I have the best of both worlds. I have all the resources of a huge corporation, everything that I need, but I still have that mom and pop feel, that engagement, that family feel that you have when you work for Navarro. So I manage some Navarro stores here in Miami, but I'm also a district leader. So I was a pharmacy manager, then a pharmacy supervisor, and I am currently a district leader. District leader manages both the front store and the pharmacy piece. So I get to impact, and I'm fully immersed in the Hispanic experience at Navarro. So I get to impact the entire experience from the moment you walk into the door to the time that you go to see your pharmacist, to the whole experience. So it's a great place to be.
Thank you, Dr. Gil Flores. So very inspiring, all of you. Thank you. So we're going to move on to question number 2. And again, question number 2, we're going to have all of our panelists participate. And as we come together to celebrate Hispanic Heritage Month, what does providing excellent care to our Hispanic patients mean to you? And once again, if we can keep our answers to 2 to 3 minutes. And once again, we will start with Dr. Rivera.
For me, providing excellent care to Hispanic patients and communities is to have a role as a liaison between the patient and caregiver, or both, with other healthcare professionals and the system itself. I want to give 2 examples, and I'm going to concentrate in the communication barrier. When I was practicing in Indiana in an acute care setting, there was this call from the pharmacy department, and I was at that time the only one who was Spanish-speaking pharmacist, because the other one was on vacation at that period of time. And there was this pediatric patient, newly diagnosed with asthma, and his family members, and none of them knew English. So not only I was able to translate for them, for other healthcare providers that were there, nurses, doctors, respiratory therapists, but also being able to explain to them how to manage asthma and how to use the medications correctly in order to make a smooth transition of care once he was discharged from the hospital. That was a blessing for me. And the second example is not related to Spanish, it's related to sign language. I decided to learn sign language because my mother-in-law she's deaf since she was little. So in order to express my love and attention to her, I decided to learn sign language. But it has not only been a blessing to her, but also a blessing to other patients that I can encounter, and being able to educate them and closing that gap between those patients or caregivers who have disabilities. It's really a very good start point, both Hispanic and patients who have disabilities, and they are very vulnerable nowadays in our healthcare system.
Thank you so much. Dr. Rodriguez?
So I think that one characteristic that maybe distinguishes us as Hispanics is that we have like a fighter mentality, don't we? We persevere. Things are not given to us or handed to us easily. So we are used to fighting for what we want and never giving up. And I think that in order to provide excellent care for our Hispanic patients, we have to apply this same mentality when we're taking care of them, right? so for their own benefit. So you can imagine that me living in Puerto Rico and working in a system which has a very limited financial resources, and sometimes we have to stretch the resources that we have. We don't have the same things that, or the same resources that other big institutions have, and some institutions in the United States, for example. So we really have to do that extra work to make things happen for our patients, even if it's like fighting for them, you know? So that includes for us, we have very limited access to maybe new drugs. New drugs arrive to the island pretty slowly. Even new technologies geared towards patient safety, or technologies designed to improve the pharmacist's workflow. Those things, those innovations and advances that maybe you're used to in some settings, they don't come so quickly to the island. So we really have to try to do that extra, to take that extra mile to give the care to our patients that they deserve. So I always try to teach my students that they have to strive to always improve their practice by finding very creative ways of solving problems, by being very persistent, and by really fighting for our patients, and by being advocates for our patients. And I think that in that way, we can really try to eat the inequalities in our healthcare system and be able to provide the best care possible for our patients.
Thank you very much, Dr. Rodriguez. Dr. Ubaki?
I think it means to build a connection with your Hispanic population, with your Hispanic patients. So that actually hits home to me. I remember as a young boy, 9, 10 years old, accompanying my mother to her doctor's appointments and actually being the translator, or trying to translate, you know, for the doctor. Back then, Coral Springs, where I grew up, Coral Springs, Florida, didn't have a lot of Hispanic doctors, didn't have a lot of Hispanic, you know, pharmacists. So I think looking back now, that connection, that importance, that communication that is needed to serve our patients, to build that connection. So that connection will open up patients to be able to share their concerns, ask about side effects, how do I take this medication, and ultimately, you know, narrow those health disparities that our Hispanic population might have for Hispanic patients. I would also take it a step further to build strategic alliances with their community, whether it be government or schools. So the communication, sometimes language barriers, we need to make sure we reach the population. Sometimes in a retail setting, we think that maybe the patient's only the person in front of you, but your pharmacy serves a whole community. So in order to serve that whole community, I think by serving, you know, our population, we need to build a network within our own community to serve our Hispanic patients. So to me, communication and building that connection with our Hispanic patients is very, very important.
Thank you, Dr. Ubaki. Dr. Widner?
Yeah, I feel like providing the culturally competent care and care coordination, taking that next step. And one of the big focus that, same with Dr. Obake, that I wanted to say is taking that time to build the rapport. There's a lot of distrust in our healthcare system, and that's with good reason, right? So, based on history, there's many reasons why our patients, especially minority patients, why they would have distrust in our system. So sometimes that means spending the extra time to build that rapport, that relationship, and learning a little bit more about some of the hesitations that patients may have, whether that's with taking their medications or actually, talking directly with some of their other providers or their specialist or something else. And then with that, taking that step back to get creative with things like with medication access, and which I'll touch on later about some of the barriers that a lot of Latino and Hispanic patients have with medication access. And, from our perspective in primary care, a lot of times our visits, we try to do as much education as we can during visits, but you always wish you could send them home with something, right? Or be there right there for their second injection of insulin that you're coaching them through. And so what I've been able to, I've been keeping a bank of resources, and I'm going to share the links in the group. But there's a video by another health center that breaks down in English and in Spanish for diabetes videos for testing blood sugars, injecting insulin, and injecting GLP-1s to help patients, really break it down from the point of view perspective. And then there's also some resources that are printable for your patients that are in Spanish from NCFH for Farm Worker Health for diabetes that I'm going to share in the group here with those links. But I think taking that extra step to, when they leave your door, just because the visit's over, it doesn't mean that your care for them is over. So connecting them with resources, maintaining that rapport so they feel that they can come to you.
Perfect. Thank you very much. And Dr. Gil Flores.
So I'll talk a little bit about the retail world. So the way that I feel about retail pharmacists is we're just so readily available. It's just so easy just to walk into any pharmacy and just have a professional with the amount of education and knowledge readily available right there at the consultation window. So I think that that's a really big part of our role, especially in retail. And it's really all about the connection, that connection that we make with our patient, and the type of bond that we build with them, because we build like these very, very, very trusting relationships. We're so highly, it's always been la doctora, el doctor, it's like they trust us more than they do their real doctors. I've had patients come to me and tell me, oh, what do you think about my therapy? I really value what you think more than what my doctor thinks. And I've had that patient come to me and tell me that that's so incredible. So it's being there, and what that means to me is being there, making those, bonding with them, connecting with them, making sure that they feel that they can trust us and come to us for whatever they need. The counseling has to be there. We're always there to guide them, to make sure that they're on the right path for disease prevention, make sure that they are there in the right path. Because if not, if they veer away, then that's when all of the different types of illnesses can come. So we want to have them in the path of the disease prevention, and that's what I think is important, for us, what it means to me.
Thank you, Dr. Gil Flores. Okay, so question number 3. So this question, we're going to start with Dr. Ubaki, and the question is, what have you learned from your professional experiences to best care for the Latinx patient? Dr. Ubaki.
Yes, so I've learned a lot and I'm still learning, right? And I love Latinx, that term, gender neutral, and it encompasses cultures within cultures. So something that my personal experience actually is very recent is I had the honor of opening, one of the first COVID testing sites, parking sites for Walmart in Doral, Florida. For those not familiar with Doral, it's like a melting pot of Latinx culture. You have everything. You have everything you can imagine, Caribbean, Central America, South America. It is a melting pot. So one of the things is to be open-minded, right? You have to be open-minded. You usually think of Latinx as your own culture, your own background. My background is Colombian, so I have my own terminology, my own ways of speaking. One of those, when you're giving directions on how to stick a swab up your nose, your own nose, and then switch it to the other side. I won't get more graphic than that. But there's a lot of little terminology that might go here and there. If you have to say, ábrelo con un pedacito de queso, un palito de queso, and they get it, the more. So be open-minded about different cultures, different terminologies. And then that led to being more, showing empathy and being more empathetic. So sometimes we think, some of our businesses, we run a business or we think about certain metrics or things like that, but we have to show more empathy towards our Latinx populations. It might be some frustrating, you're in a suit, 80 degrees, you're giving directions to someone, but you have to put yourselves in their shoes, right? You have to think, what if they have a family member in the hospital that's already sick? What if they're showing symptoms? So that personal experience I'll never forget. I learned how to be so empathetic and put yourself in their shoes, no matter how frustrated you may be in your current role, no matter what role it is in pharmacy or in life, that you have to show empathy to these patients because you never know what they're personally going through. It was one of the best lessons I got. And then to be innovative, right? You have to be innovative. Like I said, if you give us certain directions, and then my personal experience is trying to get out more in the community, how to reach a bigger audience, make more of an impact, whether it be now in schools or COVID-19, making a video for children back to school in Spanish. I'm a second generation. My parents, were born in Colombia. I was born here, and my Spanish is not great. It's pushed my limits. I made a video and, was able to make a back to school video for children in Spanish. I had to use Google Translate a couple times, but it definitely was an experience where I learned, and I'm grateful for it. And I'm grateful for our Latinx population because I think that I've learned from them more than they've gotten from me.
Excellent. Thank you so much. Dr. Whitner, if you can please answer that question.
Yeah, so I alluded to it earlier, but I think medication access is huge. And, we all know there's many different ways to help patients get access to their prescriptions, but unfortunately, not every option is available for everyone. So many manufacture patient assistance and manufacture medication assistance programs, they require US citizenship. And so therefore, I've learned that the federal 340B program is an awesome solution to this barrier. The 340B program provides safety net clinics like community health centers, migrant health centers, rural health centers, and others with medications at a significant discount. And these health centers can pass that discount on directly to the patient. And if there's certain income criteria that a patient meets, then they can subsidize that discount even further to help. And so what's important is that this assistance, it's available regardless of insurance status and regardless of documentation status. So it's anyone and everyone, regardless of their ability to pay. We can help in some way. And so I encourage everyone, if you have any Latinx patients who have difficulty affording their medications, direct them to a local health center. And I'm going to include a link here, an easy way for you to search to find a health center for a patient. And we do this all the time in our free clinic when we're connecting patients with primary care. We look to bridge them really from the free clinic setting to the health center setting. And so we are familiar with a lot of the local ones, but this is a great resource, so I'll include that link. And the last thing I'll say is, home remedies are very common, remedios caseros, in the Hispanic and Latino population. And so I think it's really important to not overlook that, and also to not push that aside as if they're not as, sometimes as pharmacists, we're big drug nerds. So we love medications and we think, we're all about the medications, but there are a lot of home remedies that, for the most part, as there's multiple studies out there that show a lot of them aren't even, they're not harmful, and they can be combined with conventional care. And so personally, I just usually work with patients to keep doses and frequencies consistent. And then for whichever of their home supplements they're taking, or home remedies for different things. And then we work towards adjusting the medications as long as those are consistent. And so there's a lot of different considerations, but I think those are two big ones. Thank you.
Excellent. Thank you so much. And Dr. Gil Flores.
Okay, thank you. So how can we give the best care for Latinx patients? So first of all, we have to be able to understand and respect all the different types of cultures, traditions, beliefs, because Latinx is not a one-size-fits-all. And like we've spoken in the past, it's, they have every type of Latin person has different types of beliefs and cultures and traditions. So the first thing is a learning part, that you have to actually be able to understand and respect and learn from what the beliefs are and traditions are, so that you can better help these patients. And how do we provide best care? Well, we have to change with the times. We have to be resilient. We have to, see what it is that we need right now. What is it that we need right now? Well, of course, we have all this COVID testing going on in our stores. I have one store that's been doing it since May. I have another one that's going live tomorrow. And our role there is to be there for them and to provide that education that they need to be able to, confront all of these challenges that we have that's going on now, and be able to keep them away from these chronic illnesses and be able to deal with all of the things that are going on. So I think that that's a really big part of giving the best care is culture, understanding their culture, their beliefs, their traditions, and being able to educate.
Excellent. Thank you, Dr. Gil Flores. Okay, and we're going to move on to question number 4. And again, I encourage everyone, if you have any questions, please use the chat box and we will get to your questions towards the end. Question number 4, we're going to start with Dr. Rivera. And the question is, what are some of the new barriers that the Hispanic community is facing amid the COVID pandemic? Dr. Rivera?
Yes, I would like to separate it in 3 barriers. Even though we have advanced a lot in telehealth or telemedicine, it has brought a lot of challenges in our Hispanic community. And the first one for me is cultural, socio-cultural, specifically with our Puerto Rican population. We used to touch, we used to kiss, we used to hug, we used to shake hands. We express ourselves a lot. And that healing touch, that's how I describe it. We miss it through telehealth now. So that's one of the barriers in order to continue to build that trust relationship and caring relationship with our patients. The second one is more socioeconomic barriers. We have discovered very low health literacy, or also a low literacy in terms of technology. And in Puerto Rico, we are facing a lot of issues with the power and electricity. So if we don't have electricity, then probably they will not be able to access internet. So that's another issue that may impact negatively our healthcare with our communities and the specific patients. And the third one, we face geographic barriers. Specifically, we live in Puerto Rico. We have a very large hurricane season. And also we have been having a lot of earthquake recently in several parts of the island. So that had a lot of issues with patients having access, going through the emergency rooms or going to the clinics. And that is something that we have to consider in how to close the gaps and be the liaison with the patients and the other parts of the systems in order to better care for them.
Excellent. Thank you very much. And Dr. Rodriguez.
Yes, thank you. So what I've seen during the COVID pandemic, I can also divide like in 3 big areas. First of all, we have seen some difficulty in the access to healthcare services for our patients. In the island particularly, we have a real need for physicians and specialists. Many professionals have left the island, as many of you might know, seeking for better opportunities in the States. So this has left our patients with a very small pool of physicians to attend them, right? So, and during the COVID pandemic also, some doctors have been reducing their working hours or not accepting new patients. So that has been a little bit difficult to arrange. People are also afraid to seek help. So we see that our patients are afraid to go to their appointments or even to go to the pharmacies to get their medications because they are afraid to get infected with COVID-19. So in Puerto Rico, we have not actually seen a very huge surge of patients hospitalized due to COVID, but on the contrary, what we saw particularly in the months of April to June was a dramatic decrease in hospital visits, like something really out of the ordinary. And what we were seeing is that many patients were delaying getting very urgent and very real need for healthcare because they were fear of getting infected with COVID. So this has been a huge issue. Another thing that we have seen is like a surge in mental health disorders. Definitely the pandemic has brought like a crisis in mental health issues. People are very anxious and they have big worries and real worries about their financial situation. So the economic barriers have become even larger, with people maybe losing jobs, the unemployment, maybe hours that have been cut from jobs, so they have been losing some of that income. So that obviously will impact their accessibility to healthcare. And they're also really stressed about their sick families or the stress that confinement will produce. So we really, what the professionals over here have been saying is that they're calling it like a surge in generalized anxiety disorders. And the third barrier that I have seen during this pandemic has been the barrier of misinformation, or the lack of access to reliable sources of information. People are totally bombarded with so much unfiltered information in social media, and they're very often left extremely confused as to what information is a fact and what is fiction. So we have to play a really important role in trying to educate our patients. They also obviously need information in Spanish, and sometimes this information that's coming out is all in English, and sometimes the information that's coming out is coming in a scientific jargon that the lay person won't understand. So we really need to step it up in educating our patients.
Excellent. Thank you very much. And with that, I'm going to pass it over to my colleague, Debbie Perales, and she will take question number 5. Debbie?
Thank you, Myra. And I want to take this opportunity to just say thank you to the panelists. I think we heard how diverse the Latinx community is. And I guess we could see it in our panelists, right? Each one have been able to share different stories. So I just wanted to say thank you for that. Okay, so I'll go to the next question. So this question is going to be for Dr. Gil Flores and for Dr. Ubaki. What are some of your recommendations to improve healthcare for our Hispanic communities? So we could start with Dr. Gil Flores.
Sure, thank you. So I think that it's so important that we take a very holistic approach and look at the patient as a whole. How can we provide support for their overall health? Our role is mostly education. We have a lot of uninsured patients. A lot of patients that are Hispanic have a lot of chronic illnesses such as diabetes. So really, we're like the gatekeeper to their disease prevention. And the way that I see it is, as a pharmacist, as a retail pharmacist, you should see how many times we have, and I can give you an example. Patient comes to me with a prescription for an antidepressant. Okay, so what happened? I fill it and I go to give it to the person, and they're like, oh, the other one didn't work for me. Which other one? And another doctor had given another antidepressant. They had taken it for just a week and they thought it wasn't working. So, we're like the gatekeeper. Okay, so let me call the doctor and see which antidepressant. Should you continue on the first one you started, because we really haven't given it the full 6 weeks that we should give it to see if it's working, or should we change to this other one that the doctor just prescribed? One was a PCP, the other one was a specialist. So this is the type of interaction that we have with our patients, that we're like the gatekeeper, and we're there to actually affect every part of their healthcare. Sometimes it's just not only prescriptions. Sometimes we're there to tell them, hey, you need to go get your A1C checked. You need to go get your mammogram. Things that don't even have to do with medications that we're actually, consulting or counseling about. So that's what I feel, that the way that we can improve healthcare the most is with that type of interaction, with our role in education, making sure that we are always focused on disease prevention, and we're like the gatekeepers of their healthcare.
Thank you. Yes, I think you mentioned before how accessible we are, right? How easy it is to go to a pharmacy and speak to a pharmacist. I think that definitely speaks to that. So thank you. Dr. Ubaki?
Yeah, and Dr. Gil Flores hit the nail on the head. Basically, we're the front line, and I challenge, I think the healthcare, the way we can help improve is challenge everyone to dig a little deeper when we speak to our Hispanic patients, right? Other than the normal counseling, ask them about you might find other comorbidities going on or something else going on you may be able to help with. And then Dr. Rodriguez also mentioned the misinformation and education. That's huge, 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 huge. Going on in our community. So many times, in the past, this past week, I've run into patients being, oh, I don't want to get the flu shot yet because I want it to last all season. I have to get it in January so it'll last for flu season. And I'm like, take a deep breath. Here we go again, right? So our role is to educate. It's not, to improve the health outcomes of our patients. They have to know what it's about. And the only way to do it is by digging deeper and getting more information from them, right? And then again, the individual you may be helping is in front of you, but we also have to build strategic alliances with our government and, for example, DEA takebacks events. Go and speak at city halls, commissioners meeting about, educating the public about the importance of flu shots, things of that nature. So going out there, getting our voices heard, and also be able to communicate, like Dr. Flores spoke in both languages, English and Spanish. And Dr. Rodriguez said, I did go through some of the CDC things, and a lot of the things were in English, and some were not available in Spanish. So we can improve it by digging deeper with our patients, be able to communicate effectively, and getting some of that misinformation out there and educating our patients.
Thank you. I completely agree. So, hey, so the next question is going to be for all panelists, because I think that each one of you could provide, some insight into this question. So, question is, what words of advice do you have for our pharmacy students and our new pharmacists as they work to improve the health of Hispanic communities? And we'll start with Dr. Rivera.
Well, I have one for each. One as pharmacy student, or for our pharmacy students, actively participate in interprofessional and co-curricular activities while you're at school. You have to get to know other healthcare professionals that you can value what they do, know exactly where they are, how can they help you with the patients and their caregivers and their families in order to better care for them, and also have their phone numbers in order to make the referrals where they have to go, either to the speech pathologist, to the nurse, to go to a physician or physical therapist, occupational therapist, all of them. The second advice is for those newly minted pharmacists, our colleagues, continuously engage in community outreach and community-based activities such as health fairs, vaccination campaigns, brown bags. It's very important for you to be out there and being available and accessible to them, and show them that you care. Show our community that you care for them and that you're there to serve them. I think that's very important, to continue being engaged with the community, not only as part of your curricular activities.
Thank you. Dr. Rodriguez?
Yes, thank you. So my first advice would be that learning does not stop once you graduate. So you have to stay up to date all the time. And I would really like to encourage those students or those newly graduates to really seek further training in the diverse forms that we have. It could be board certifications, residencies, certificate programs, special workshops, anything that tickles your fancy. I mean, you can think outside the box. You can think about taking some training in emergency response, in suicide prevention, in thanatology, in alternative medicine, public health, managed care. I mean, all of these things are only going to improve your healthcare skills. Second of all, in pharmacy school, you were used to, or maybe you participated in some kind of big research project or some smaller quality improvement projects during your rotations. I would like to encourage you to continue doing those kinds of research activities during your careers, because we need to see in our practice what are the things that are working for our patients, what are the things that are not working for our patients, and do that in a systematic way so that we can ultimately improve our practice. And third of all, I would like to encourage all of you to participate in public forums, in national forums, because we need more Hispanic representation in all kinds of forums. It could be government, professional organizations, at the corporate levels in your own private organizations, in interest groups or community-based groups.
Thank you, Dr. Rodriguez. And then hopefully NHPA could be one of the ways that we could do that, right?
Yes.
Thank you. Dr. Obake.
Yes, it's to remember your personal experiences growing up as, you know, a Hispanic yourself and a Latinx, and use those when you go forward. Build a good network around you and be involved in where you are. Push your boundaries. You know, this is the perfect time. It's not only learning, you know, side effects and, you know, mechanisms of actions. This is a good time to evolve. You're not a good speaker, practice speaking. Take one of the speech classes. Get involved in one of the organizations. Take a position. Push yourself, because this is a time to learn from your mistakes, and be open to receive feedback. If you're a student or if you're a new pharmacist, you may not know everything. Be acceptance of feedback. Feedback is how you grow. And then don't be afraid to challenge your mentor and grab a good mentor and give them feedback, because you're the basis of innovation. You're the new minds coming out. So you're very important to our industry, so it keeps evolving.
Thank you. Dr. Widner?
Yeah, thank you. I feel like volunteering, I think, is huge. You know, I'm a little biased. I love the free clinic atmosphere, so I would say encourage you to look into local free clinics in your area. Big cities like in Columbus, there's actually a free clinic open every single day of the week, including Sundays, depending on, there's the Latin free clinic, there's Asian free clinic, there's so many different. And so if there's one in your city or area that focuses on the caring for Spanish speaking families, I think that would be an awesome way. You know, there's many Latino patients, they have fears about establishing with an official doctor, whether those fears are rooted in potential increased years with ICE and some of those concerns and considerations with separation of families and things. And so many patients use they may use free clinics as a replacement for primary care. And so at that point, it's our great opportunity to use that for patient education and for getting creative with connecting patients to local community resources and events. And really, I feel like you become more in touch with the community almost with free medical clinics. So, and the patients that we serve. Additionally, almost all free clinics by nature are interprofessional because that's the way they run by volunteers of all professions. So if at the other very least side of the spectrum, you're able to show other healthcare professionals the power of having pharmacists part of the care team, because I can't tell you how appreciative other providers are once pharmacists are ingrained. A lot of times it comes up with, at first, well, we never had a pharmacist, or we never had a pharmacy student. You know, what does that look like? And so, you know, we started an art free clinic with it, and I brought a pharmacy student in, and we basically just created something, worked in the workflow, and trialed and errored and see how it went. And now they expect us there. You know, I wish we could be there more often than, you know, and that's why we need more people to continue to volunteer, more students, more pharmacists to volunteer your time, especially if you can speak another language, that you can really break down that barrier of care for patients and building that rapport. So volunteer, it really is one of the best things you can do for your communities.
Thank you. Then Dr. Gil Flores.
Thank you. Okay, so words of advice. So the first thing I have to say, and especially because it's for Hispanics, is embrace your culture. Embrace your culture. Being bilingual is such an asset. It's so incredible. Immerse yourself in your culture and make sure that you market yourself with that and develop yourself in that way, in that manner, so that that could be an asset for you in the future. The second thing is, and several of you have said it already, to get involved. Get involved. Like, we've had to stop our clinics. We had some health clinics that we did on Saturdays, where we had all of our interns come in and do glucose screening, diabetes screening with blood glucose, blood pressure, hypertension screening. Those type of things are such great experiences for you as a pharmacy student, and it's gonna help you be the professional that you need to be in the future. And thirdly, be a leader. We're looking for leaders. We need leaders like you. Be a leader that's resilient, that adapts to the changing times, the changing needs, and excel. Excel in whatever path that you want to be or do. Whatever path you take, make sure you're one of the best that you can find. Always try to excel in whatever you do so that you can make yourself known, and wherever you go, you're going to be wanted, and everybody's going to keep you wherever it is that you are. So those are my three things. Embrace your culture, get involved, and definitely be a leader.
Thank you. So Dr. Gil Flores, I guess we'll stay with you, because the next question, it's actually for you and for Dr. Widner. So what efforts are being done, at your company or institution to help increase the number of Hispanic pharmacists?
Okay, so I'm going to talk about CVS, since I work for CVS, and I can tell you that our company is very, very engaged in recruiting Hispanic pharmacists. And Hispanic pharmacists are very much needed in our company, especially with all of our diversity initiatives. In 2015, when Navarro was acquired by CVS, they acquired us because why? Because they were looking for a Hispanic niche in the workplace. They were actually looking to see how they can connect better to Hispanics. That's why they acquired Navarro. So they actually took Navarro as like an example, and they created a new CVS, which is the CVS IMAS platform. And that is kind of like a baby of a Navarro and a CVS, and that's the CVS IMAS. And of course, to run all these CVS IMAS stores and pharmacies, what we most need is Hispanic pharmacists and Hispanic people that can communicate with our customers and our patients in their language. So that is key to being able to have this successful business. So CVS is very much in need of people like you, or Hispanic people that are on this WebEx. We definitely need, that's what we're looking for. And also CVS supports Spanish language education. So let's say that we don't have the Hispanic pharmacists that we need, they actually have a program where they can do like a Rosetta Stone type of program to help them learn to speak Spanish, because that is so important for them to be able to communicate with the Hispanic patient, especially in the pharmacy. And even in the front store, you still need to have that connection with the patient. You need to be able to talk their language and understand what their needs are. We also have another program called the Spanish Immersion Internship. And this program is very close to my heart because we were one of the first pharmacies that actually piloted this program. So what they do is they take an intern, a pharmacy student, and they put them, it's usually someone who's not Spanish speaking, and they put them in one of our stores. It's always been a Navarro, now we're doing the IMAS stores too, but it's a highly Hispanic type of store. And it's for the whole summer. And by the end of the summer, they know all about how to communicate with the patients in Spanish. They've developed their Spanish greatly. They know all about all the Hispanic products that we have out in the OTC area. And it's a really great experience for them. And we always, after they leave and they go back to wherever they came from, we send them a little gift bag with some café pilón and some mariquitas and stuff to make them feel like they're still in Miami and they're still with us. So that's a great program that we have. But about only 4.5% of pharmacists in the nation are Hispanic, and we want to change that number. We want that number to be higher. So definitely we want more Hispanics to become pharmacists.
Thank you. Dr. Widner.
Yeah, thank you. So community health centers we're served by a 51% or more patient majority board. So Our board of directors are therefore, that reflects a representative sample of our patient population, and that includes a large representation of racial, ethnic minorities, and not surprisingly, that carries over to our health center staff and our employees. We have a diverse representation that adds to the culturally competent care that we provide. And we seek clinicians and staff who speak a variety of different languages, including Spanish, Somali, Nepali, and so forth. And currently one of our health center sites is about 70 to 80% Spanish speaking. And so if we have pharmacy students who speak Spanish, I try to arrange for them to have time in that clinic to use their skills, although we see a lot of Spanish patients across all of our clinics. But I think that that's a good opportunity to help precept through that. And then showing pharmacy students the mission-driven atmosphere of a community health center, and hopefully sparking the fire of them to pursue a career with us or another safety net provider is what we strive to do. That's something that we market through our residency program as well to prospective students and residents through that. It's one of the main reasons that I was interested in this PGY2 residency was for the Spanish-speaking component and the large Hispanic and Latino population that I could serve. And so I encourage, if you're interested in that, and obviously you are because you're on this call, and continuing to serve the Hispanic communities, I would encourage you to seek that out in your APPE rotations, APPE, or your residency opportunities. There is a severe primary care shortage, and health centers are the primary care backbone of the United States. And the role of pharmacists within health centers is expanding greatly. So our patients can only benefit from more pharmacy involvement. That's for their individual outcomes, that's for medication access, for coordination of care. And if you can accomplish all of those three things without adding a language barrier in and removing that because you can speak Spanish, I mean, that is going to just greatly expand the capabilities and the benefits and advantages of pharmacists being in this type of underserved primary care setting. So I would say, there's a variety of opportunities out there, but I know one of the questions as well is about what pharmacy students can do. So I'll leave it for that at that point. Thank you.
Thank you, Dr. Widner. So I'll kind of just say the last official question. So we have a couple of minutes left, and there's some questions that I have received here in the chat. So the first question comes from, and it's actually for all panelists. So it comes from Beatrice. So it says, I'm in Michigan. We need more Latinx bilingual healthcare providers, especially pharmacists. How can we encourage more Latinx to pursue a career in pharmacy? So any of our panelists who want to take this question? So how can we get more students, bilingual students to be interested in pharmacy?
I think that from the perspective of a university standpoint, we can go and talk to students since middle school. Even in our service learning practice experience that we have with P2 students, sometimes we visit, there's a group that goes to preschoolers and tell them some things regarding the difference between medications and detergents and all of that. So they can see this part of the pharmacy that is engaged in public health. And then you go to middle school, then you go to high schoolers. So you have to impact them and make them know that pharmacy is more like people usually see us like counting pills. It's more than that. So if you engage early on in their education by going to different community-based or schools or churches or Lions Club and all of that, you are going to be able to market our profession as a profession of service and engage since very little, age, young people to enjoy what we do.
Thank you. So I guess if we wait till they're in college, it might be too late, right? We need to start early on to
I think so.
Let them know that. Yes, thank you. Okay, so I'll go to another question that I have here. So, and this is more for the panelists who are preceptors. So what are some suggestions for students to prepare for rotations? Like, what do they need to do to be able to be ready for that experience?
I can start with that. I would say being proactive is a great trait to have when you're looking to prepare for rotations, and so keeping an open mind with that too. So rotations, you're not supposed to specialize in an interest in rotations. Rotations are meant to get you a broad range of all of your experiences throughout at the end at the pharmacy school. So sometimes people think, I want to do peds, so I'm going to do all my rotations at a peds hospital, or try to, or in that type of thing. And so I would say use it as a time to expand that your horizon and get an idea of all the different areas of pharmacy, and keep an open mind. And then be proactive with communication with your preceptors. So contacting them ahead of time. If there's anything specific for that rotation you can do to prepare, and letting them know what you're excited about and what you want to learn. So preceptors aren't mind readers, as much as we'd love to be, as much as we would hope to be. So a lot of times we don't know what you're interested in unless you tell us. And sometimes, we do our best to get that out of you, but coming to the rotation with what you're interested in and what some different things you'd like to see or what you want to get out of. I mean, I was able to see, a wide variety of things that I otherwise wouldn't have been able to see if it wasn't for speaking up that I was interested. And that's in seeing an open heart surgery when I was a pharmacy resident, and then, or when I was a pharmacy student, and then doing a ride along in a life flight helicopter as a resident. So those are things that I just randomly said I would be interested in, and they made it happen. So show your interest and get that. So thank you.
Thank you for that. So I'm gonna ask one last question, because I know we're a minute over, but I think this is a good one, and I would like Dr. Ubake to answer this one. So question from Kay, and it says, one of my biggest concerns is helping my Hispanic patients get immunizations to help them get protected. How do you suggest helping to bridge the cultural gap and help them understand the importance of immunizations, and how do pharmacists that don't speak Spanish reach this part of our community? So that was a mouthful, but I think you got it.
Yeah, okay. So I kind of got two parts of that, but the most important, I think, is engaging and challenging our customer, who, instead of, in many cases, an opportunity we might see some of these community pharmacies is that they just ask the patient if they want a flu shot, and they go, no, I got sick last time. So I think it's a good thing. Opportunity is to actually challenge the customer, ask why. Why don't you want to get your flu shot? What are the concerns? And then address those concerns. And then especially in Spanish-speaking population, you want to make sure you have the material and the signage, and the language barrier is addressed. I know personally in my pharmacy, we have the vaccine information sheets with English and Spanish right at the window. We have PA announcements in Spanish. Our signage is in Spanish. And then, and then we have to have a conversation. If you are not a comfortable Spanish speaker, or you have, let's say your partner, or you're concerned about a pharmacy that doesn't have a Spanish-speaking pharmacist, this is where you want to work together with your institution, or whoever you work for. There's resources. I'm sure there's the coworker that is a fluent Spanish speaker. You can reach out to community, work together, make videos. I know in our case, actually, we just recently, I work with another pharmacist who does not speak Spanish, and I was able to, do a little PowerPoint slide in Spanish with the best I could, and get that education out there, that information out there. But definitely engaging the patient and asking the whys, and not just giving up on their no. You want to dig deeper and ask them why, and very challenge them and educate them, so they're not misinformed.
Thank you. And actually, now that we're at the end, I wanted to invite our NHPA president, Dr. Maria Rivas, to say a few words to the group.
Good evening, everyone, and good night at the other end of the U.S. in Puerto Rico. I just wanted to jump in and give a big thank you to all of our panelists for taking the time out of your day and your evening to show and share with us some of your words of wisdom. And then also to all of our attendees for joining in. And this session is recorded, so others will be able to watch it at another time if they're not able to participate right now. And then I also wanted to give a huge thank you to our board members, Mara Boitel and Debbie Perales, for hosting and moderating. Thank you to everyone. And then I also wanted to give a special thank you, even though they're not here with us right now, Dr. Elena Rios and Dr. Mark Diaz for being our national Hispanic Health Foundation guides as we develop NHPA. And everyone, please stay tuned as we continue to roll out the rest of the programs as they were mentioned earlier. And so thank you very much, and I'll hand it over back to our moderators. Thank you so much, everyone.
Thank you, Maria. So Vincent, if I could have back the slide with the different ways to get in touch with us. Thank you. So again, I want to say thank you to the panelists, for your time and for all of the experience and the knowledge that you share with us. I definitely learned a lot. So thank you. And I wanted to take this opportunity, right, to again, as Myra mentioned, just include all the different ways that you have to connect with us. I know that we couldn't get to all of the questions, but you could see the different ways that you could get with us, and then we'll try to answer all of them. I know we talk about mentoring, and there were a lot of people that kind of reminded us that they offer to do that, and we're going to be working in that. We're going to be working in partnering and having those relationships and pair those mentees with those mentors. So thank you for that. Myra, any last words from you?
No, again, thank you very much. I can only say that I'm really inspired by our panelists. Just to hear your passion for our Hispanic patients is really very inspiring. I am a pharmacist myself, of course. I've always worked in Hispanic communities, and I can really say it's been the most rewarding part of my career. So for all of those students out there, I encourage you. Hispanic patients, they need you. And everything that our panelists have said here, it really strikes home. So again, thank you very much. Thank you for being here. And please follow us and connect with us as best as you can. Everyone have a good night.
Thank you. Buenas noches.
Buenas noches.
Thank you.